morning, sir.
Good morning, nurse.
Introduce my name is Nurse Ghosa, who is exactly this morning. First of all, may I know your name?
My name is Tony Atmaja. Just call me Tony.
Okay, Sir Tony, may I know your age?
I'm 37 years old now.
I'm here conducting an assessment of Mr. Tony to determine your current condition. Takes about 5 minutes. Is Mr. Tony please?
Yes, nurse.
What seems to be the problem, sir?
I have difficult urinating and have pain in the lower abdomen and around the penis.
What kind of pain do you feel?
Like stab and throbbing pain. The pain increases when I and decreases when I lie down.
If on a scale of 0 until 10, on what scale do you feel pain?
Look like a scale of 3, nurse.
Do you have a history of this kind of illness?
No, the pain I feel right now comes after the accident.
Has anyone in your family ever experienced anything like this?
No, nurse.
Okay, sir. For the present experience, later I will continue with a physical explanation to find out more specifically your condition. Are you pleased?
Yes, you can.
Well then, I will excuse myself first. Thank you for your cooperation. Good morning, sir.
Good morning, nurse.
Hi everyone, my name is Binti Emilia Palupi. My study ID number is 2183. I'm a member of Group 5 English in Nursing from Class D. And I will perform a chest examination to the patient with a urethral injury. And I use a doll to perform chest examination with a patient. I will personal protective equipment in the form of a mask and latex gloves. And after that, we check patient vital sign. Okay, let's see. Excuse me, miss, I'm a nurse Binti and I will check your vital sign condition for today, okay? At the first, I will put a thermometer to your armpit, miss, okay? Excuse me, miss. And after that, I will put spike manometer to measure his blood from pressure, okay? Excuse me, miss. Your blood pressure is 110/90. It's so good, miss. And your body temperature is 37 degrees Celsius. I will check your respiratory, miss. Excuse me, miss. Okay. And your respiratory is 20 times per minute, miss. And well done for check vital sign. And then I will check your chest, miss. At the first, inhale through your nose. Good. And exhale slowly through your mouth, please. And please repeat again, miss. Okay. Inhale through your nose. And exhale slowly through your mouth, please. Okay, good. Yeah, well done from chest examination, miss. Thank you. On a chest examination, there is a lung and heart examinations. After a chest examinations, the results were for lungs. Number 1 is inspections. The patient chest shape, symmetrical left and right chest, regular chest wall movement, respiratory rate 20 times per minute. And number 2 is palpations. There is no tenderness. Tractile vermitus vibrate simultaneously. And sound strong between left and right. There is no mass in the chest area. And number 3 is percussions. On percussion, on the left and right, lungs sound resonant. And number 4 is auscultations. In the auscultation is positive vesicular and no wheezing. Next, heart. In the heart, there is number 1 is inspections. Ictal score is not visible. CRT less than 3 seconds. And number 2 is palpations. Ictal score will palpable at the 5th ICS. No tenderness. And the number 3 is percussions. Upper right heart border ICS 2 line parasternalis dextra and right lower heart border ICS 4 lines parasternalis dextra and upper left heart border ICS 2 lines parasternalis sinistra and left lower heart border is ICS 4 lines medioclavicularis sinistra. And for number 4 auscultations, regular heart rhythm, no additional sounds as a murmur or gallops. Okay, thank you everyone.
Hello everyone, my name is Alya Izzatur Rohmah with ID number 20 and 179. I will practice about abdominal physical examination on patient with urethral injury. Before entering the room, we must prepare the necessary tools, namely gloves, stethoscope, pen, and medical books. Hello, Assalamualaikum sir. Waalaikumsalam. My name is Alya Izzatur Rohmah. I am nurse in this shift. Excuse me sir, what's your name? My name is Alya. Oh, okay. How old are you sir? I am 37 years old. Oh, that's right. In my data, that's correct in your name and your old. Okay, sir. According to the examination schedule, now you will doing an abdominal examination. Namely, this check will last for 5 until 10 minutes. Would you be able to allow this examination, sir? Yes, please. Oh, okay, sir. Thank you. Could I be able to prepare the equipment firstly, sir? Yes, please. Thank you, sir. Firstly, I wash my hand with 2 steps and then I use gloves. That's right, one by one. After that, I prepare the position of the patient in the supinal position. And then I request permission to take action. Excuse me, sir. Could I able to start abdominal examination? Yes, please. Okay, sir. Could you able to upper your shirt under the nipples and lower the pants until symphysis pubis? Okay. Okay. May I help, sir? Yes. Okay, excuse me, sir. Previously, I divided the abdomen into four regions. There are upper left, upper right, and then lower right, and then upper left and lower left. Step 1 is inspection. Inspection is to observe the condition, size, skin color, shape of the patient's abdomen, and etc. Excuse me, sir. Could I able to observe your abdomen, sir? Yes, please. Thank you, sir. Your abdomen look is a dullness in each abdominal region. No injuries, no rashes, and no bumps in there. Step 2. Auscultation. Auscultation is examination by listening to organ sound with stethoscope. Excuse me, sir. Could I able to listen the bowel sound in your abdomen? Yes, please. Okay, thank you, sir. In the upper right, after that in the lower right, after that in the upper left, and after that in the lower left. Okay, thank you, sir. Your bowel sound are normal at 10 times per minute, and there no vascular disturbance. Step 3 is palpation. Palpation is examination to detect the presence of tenderness in the abdominal area. Excuse me, sir, could I able to palpate and press your abdomen to find tenderness and mass in there? Yes, please. Okay, thank you, sir. Not use stethoscope, just use fingers. Okay, sir, excuse me. In the upper right, do you have pain, sir? No pain, nurse. Okay. In the lower right, do you have pain, sir? No pain, nurse. Okay. In this? Yes, nurse. Okay. In the upper left, do you have pain, sir? No pain, nurse. Okay. After that, in the lower left, do you have pain, sir? No pain, nurse. Okay. In this? Yes, nurse. Okay. Okay, sir. Your abdominal has tenderness and mass in the central lowers, specifically in the bladder. Step 4 is percussion. Percussion is examination to know the location of organ by tapping with a finger. Excuse me, sir, could I able to tap your abdominal to find out if there is dilation in your internal organ? Yes, please. Okay, sir, thank you. In the upper right. Okay. In the heart. Okay. And then in the lower right. In the upper left. In the lower left. In the bladder. Okay, thank you, sir. Your abdominal has dilation in your bladder because the bladder sound is deaf. Okay, sir. This abdominal physical examination is finished. I will record the result of this examination in medical book and you could tidy up your clothes again. Can I help it? Okay, thank you. Okay, sir. Thank you for your cooperation. I hope you get well soon, sir. Amin. Amin. Excuse me, sir. I will back in nurse room and I will visit you again for further physical examination. Yes. Okay, sir. Thank you. See you. Wassalamualaikum warahmatullahi wabarakatuh. Waalaikumsalam warahmatullahi wabarakatuh. Okay, after that, I will take out my clothes. Like this. And then wash my hand with 6 true steps. Okay, that's are the steps of abdominal physical examination for patient with urethral injury. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Jesica Daryanti with student ID number 20-156. Here I will do an examination of the genital area. It occurred in a male patient and in this case is urethral injury. After that, the patient position is supination. First thing first, equipment that needs to be prepared in the examination of male genitalia is a gloves and then a pen to perform translumination examination if necessary, and then gauze, and then wadah bengkok. Okay, the procedure for examining the male genitalia includes inspection and then palpation, and the last is transillumination. Inspection on examination of the male genitalia include 1. Pubic hair. A pubic hair observes the distribution of hair on the genitalia. These hairs are coarser, more abundant in the pubic region, and may extend to the umbilical region. The second is penis. Observe for dorsal veins on inspection, and then it should be noted whether the patient has been circumcised. If not, the prepuce can be pulled back slightly. And then if the prepuce cannot be retracted, this condition is called phimosis. Inspect the penis for lesion bruising, swelling, or erythema. And then inspection is also whether the patient has a prolonged erection condition called priapism. Pay attention to penis size abnormalities. It can be a micropenis or a macropenis. The third is urethral meatus. Note the small slit-shaped orifice located on the ventral surface of the tip of the glans penis. Note the presence of fluid dripping or erythema at the meatus. Note also the position of the meatus. The meatus can be dorsum or epispadias or ventral is hypospadias. The fourth is scrotum. The scrotum is often darker in color than the rest of the skin, with a raw surface. A red scrotum indicates inflammation. The left scrotum may appear asymmetrical because the left testicle has a longer spermatic cord. On the skin of the scrotum may appear lumps due to sebaceosis. Thickening of the scrotum may occur due to edema due to fluid retention. Enlargement of the scrotum can also be caused by filariasis. And 5 is testes. Most adult male testes are 4 cm long and 2.5 cm wide. Further examination of the testes is done by palpation. The second is palpation. Palpation or examination of the male genitalia is carried out as follows. And one is penis. Palpation is done on the shaft of the penis to feel for pain and induration. A normal penis that doesn't have an erection is soft and not nodular. Compress the base of the penis and move it slowly toward the glans penis to drain the urethral fluid. Then gently retract the prepuce in the uncircumcised patient. The second is urethral meatus. To examine the urethral meatus, press on the glans penis from both sides. The color of the normal meatus is pink. If you see redness or discharge from the body, this indicates is inflammation. And then the shape of the meatus is round or pinpoint, indicating the presence of stenosis of the meatus. The third is testes. Palpation is performed on the testicles to assess for texture, tenderness, and irregularities. Palpation is done using the thumb, index finger, and middle finger. Normal testes will feel smooth, supple, and no nodules. The testes are sensitive to touch but don't cause pain. Also perform palpation of the epididymis in the posterolateral direction of the testes. The epididymis is smooth, well-defined, and painless. And acute epididymitis causes the testes and epididymis to be indistinguishable on palpation. Okay, number 4 is vas deferens and spermatic cord. The vas deferens is smooth as and well demarcated. If the palpation feels uneven, it may be caused by diabetes or old tuberculosis. When the patient is standing, a dilated venous mass or varicocele may be found. The Valsalva maneuver can increase dilation. Number 5 is cremaster reflex. The cremaster reflex can be performed by rubbing the inner thigh with a finger or a blunt instrument. The normal cremasteric reflex will cause the testes and scrotum to rise on the same side. Number 6 is hernia. To check for a hernia, the patient may be asked to stand up, then strain. Inspect the inguinal canal and fossa ovalis for bowel masses that descend into the inguinal and return to the abdomen when the patient is relaxed. Number 7 is prostate. Palpation of the prostate is done by digital rectal examination. The index finger is inserted into the rectum. Then palpation is done using by index finger towards the anterior wall of the rectum. Assessment carried out are the size, contour, consistency, and mobility of the prostate. And the last is transillumination. Transillumination is performed on the scrotum if a mass or enlargement is found. Transillumination can distinguish solid or liquid masses. Reduce the mass by pushing it through the external inguinal canal, then transilluminate it using a pen-like on the scrotum. If the mass can be reduced and undergoes a bright red transillumination, then there may be liquid as in the hydrocele condition. A mass that isn't transilluminated but shrinks at the time of reduction may be a hernia. Masses that don't transilluminate and don't shrink may be solid masses such as tumors or incarcerate hernias. Okay, that's the explanation from our group. Sorry if any more or less sentence. Wassalamualaikum warahmatullahi wabarakatuh.